Not ready yet. This morning, I'm happy to introduce a subject to do with cancer diagnosis, a guide to patients and families. I'm sure all of you agree with me that this topic is close to many hearts. And I would suggest that can we together take a second or two to acknowledge the strength and resilience of each individual joining this morning, especially those who have had, who have faced and are currently facing the challenge that comes with a cancer diagnosis. Just a second to congratulate yourself that you have joined in today. Team Purposeful Aging appreciates your presence here and is lucky to have two speakers this morning. These are two incredible ladies who share their unique perspective of this journey. Our first speaker, Miss Leah Kasule, is a remarkable individual who has triumphed over challenges of cancer. Miss Leah Kasule will share her personal journey and insight into what it was like to receive the life-altering news of a cancer diagnosis. This journey is a long journey, but she will give us those areas where you and the caregivers and everybody else stand to benefit this morning. The second presenter will be Phebice Kithibitho. She's a counselor working at the Uganda Cancer Institute at Mulago Hospital at Old Mulago Hill. I think she's worked there over 10 years. Sister Bira is an experienced and passionate counselor who has dedicated her career to supporting individuals and families in the cancer ward. She brings a wealth of knowledge and expertise in providing emotional and psychological support to those navigating the complexities of a cancer diagnosis. That is to both the patient and their relatives. To say a little more, she has accepted to really bring out the crucial role cancer plays in the journey towards healing and recovery in cancer. As you all know, this is a journey of courage, hope, and resilience. To Leah and Bira, could you just say good morning to everyone? Just unmute and say good morning.
Good morning.
Thank you. Yes,
good morning, everyone. Good morning, seniors. I feel so honored this morning to speak to you, the seniors.
Thank you so much. Yes, that was my very next point. As older adults and caregivers here today, they are so anxious to share with you, and are grateful for your willingness to open up and inspire them today. As older adults, cancer is very common in our age group. And as you are aware, cancer affects not only the person diagnosed, but also affects our loved ones. Together, let us create an environment of understanding and empathy. Yes, as usual, the session is interactive. We encourage you to actively participate in the discussion. Feel free to share your thoughts, ask questions, and provide insight. It is a safe space today, and your experiences and perspectives are very, very valuable. So if you have any questions and comments for our speakers, please type them in the chat, and we'll address them after the various talks, the 2 talks. Okay, let us approach today's session with open hearts and a mind, and open heart and mind. Together, we can learn and support one another. I do feel that maybe at the end of this session, all of us will be in a better position to foster a positive community where individuals can learn from each other and each other's experiences and gain strength from shared stories. At this juncture, I would like to invite Leah Kasule, our first speaker, to share her valuable insight. Leah, we have older adults and caregivers, and they are very, very eager to listen to your story in the next 10-15 minutes. You can unmute Leah, and it's all yours now. Leah is actually out in the field, and I don't know, we might have to bear with glitches here and there. Leah, you ready?
Leah, you're still muted in case you're speaking. We can't hear you.
You click that mic. Leah is the first button on your left.
Nah, yeah. Hello.
Yes, Leah, you're free to speak.
Are you hearing me?
Yes, we can.
You are hearing me?
Yes, huh? Leah, we can hear you.
Yeah, I'm sorry. I don't know what is disturbing me.
No, now we can hear you. We can hear you, Leah. It's okay.
I'm sorry. I don't know. Now, this is Leah. This is Leah. You are hearing me?
Yes, Leah. Yes, yes, we.
I'm a survivor. I'm called Leah Kasule. I'm a survivor. I volunteer in Uganda Cancer Institute. I I'm a counselor, and I'm a community cancer educator. Most of all, I'm a cancer survivor, breast 26 years. Now, my journey was not easy. I started in 1998. I was at work. I came back home. I touched my breast and I felt the lump on my right hand. For me, my brothers were also telling me, their doctors, saying, Leah, you have to check your breasts. Hello? Hello?
Yeah, with you, Leah.
And I'm afraid
No,
because you
don't
can,
worry. We understand. You can go ahead.
because no, sometimes I say maybe they are not hearing as because I've been disturbed by these things here where I am. So I went to
We
the
can
hospital.
hear you.
Okay. I went to the hospital. Before I went to the hospital, I called my brother. He was in Germany. And I told him that I have something here. He told me, you go to the doctor and see what it is. I just went to the doctor. Then they gave me the X-ray. He said, this is cancer. From that day, I went with my sister. I called her and I told her that the doctor says this is cancer. And I went back and told the doctor, what can I do? He told me, you have to cut that breast. That breast we are going to cut off. I said, doctor, you know me. That was, by that time, Dr. Sebale. I have to mention that because he didn't do any bad thing. He told me, you have to cut that. I said, I was born with 2 breasts and you want to cut? And my sister said, let us go. That doctor of yours want to cut our breasts. Now the breasts are for 2 people. That is how I started my journey. The what?
Is it the man and you, or you and your sister?
And my sister. Now the breast are for 2 people. The doctor wants to cut our breast. Let's go. I started crying. And that time, I saw the stars. It was about 10 in the morning. I saw the stars. It was in a black place. The stars were there as if it is night.
Yes. Waziba.
I also only the stars and the black. So I went home. I started the journey. But to go back, I thank God. I glorified God who treated me, because doctors, nurses, and other people can treat, but God chose. I went back. I was crying. I met someone. I said, let's go to the other one. He just put off the lamp. Then I said, that doctor is bad. Let me go to the other doctor. They put off the lamp. They operated me in Mengo. They put off the lamp. They told me to go. But I didn't know whether that one was a biopsy. He didn't tell me. So it is a lesson. When you do something on a patient, the head is already off. You tell them, you explain what you have done and tell him or her next step. Didn't tell me. I went home. After 2 weeks, 3 weeks, then the brother rang me again and said, you go to radiotherapy. I went to the radiotherapy. Good enough, I met Dr. Chigula is my friend. I always talk about those people. I went and he told me, Leah, Doctor so-and-so, Dr. Sentongo is my brother. He told me, rang me that you have cancer. Now we have come. Have they operated you? Have they done the mastectomy? I said, no, but I'm okay. I was very happy. He said, okay, come here. Raise your arm. I raised my arm, and he found other two in the armpit, which was not there at first. He told me, now you are going to be operated. That breast is going to be cut off, and you get cured. I said, no, this isn't, they did enough. They said, no, let us do the right thing. He took me, I said, you will work on other people. Let me go. He said, no, I know you are my friend. Then he took me to Dr. Gakwaya. Those two people did a lot of work. He took me to the doctor. He started drawing pictures, the advantage and disadvantages of mastectomy. He said, if you don't do cut off your breast, this will happen, this will happen, this will happen. So I agreed. After long, I was going there every day for counsel for a week. And he bared with me. He said, now, every day you can come here. And I talked to you until you agreed. Then eventually, I was operated. But it's not easy because I had my 4 children. I have 4 children. In that circle, after diagnosis, my mother died. My sister died. My husband died. My aunt died. And I got, yes, and I was left alone. So I was there, hard like a stone. Because my mother, when my husband died, I just kept quiet. I didn't tell my mother because my mother was in the house. So next day, the aunt, who I thought that I stay with my aunt, the sister of my mother, also died pressure. Then after burying my mother, next day my sister died. I left alone. I had my brothers and his sisters, the step. So other 2 people were out of the country. I suffered. I really suffered. But I was left alone, but I was not alone. I was with my God. Jesus helped me. And I was looking at the house. I'm going to leave the house. I was renting, not my house. I looked at the children. The last born one was 1.5 years. So I looked at that one. So what I did is to go to the big shops. I bought 4 blankets. I said, even if the children will not eat, but they recover themselves. Little did I know that those people who come to bury, they want new things, they will take. But I said, let me buy these blankets for my children in order for them to cover themselves if I'm not around. So I was operated by Dr. Gakwaya, very nice doctor. I was operated and was successful. Within a day, I went home and I started the journey of treatment. I was given a radiotherapy. I was given tamoxifen, the last one, tamoxifen. That is, first of all, they operated me. I got surgery, radiotherapy, and the chemotherapy, and hormonal therapy, the last one, for 5 years. The journey was not easy, but all that, God was with me. I didn't tell many people. Tell me, I talk about it after some time. That is a short journey, I can tell you, but I have many. Thank you very much.
Thank you so much, Leah. I think You did not only tell us your story, but you really beat us, as we say. Yeah.
Sure.
I think there are questions, but I suggest that we hear from Fabrice before we go into question time. And I think it will give us a bit of breathing space, because I think we are all seeing stars at present. At least I am. So can we have Bida please come in and help us? We are that deep down there.
Thank you, Dr. Kadama. Good morning, seniors. Good morning, everyone.
Good morning.
I feel so honored this morning to speak to you. Yeah, you have heard it from Leah. It's not easy. Getting cancer diagnosis is not easy. It's also not easy to our side who give the news.
Breaking news.
Yes, yes. Breaking the news is also not easy at our side. Like you had it, getting news of a life-threatening disease. It really disorients the person who is getting the news. The person who is getting the news goes into shock, like you have had it from Leah. Started at the very beginning, there's that fear. Because it is life-threatening, there is the fear. They start getting worried, the anxiety, the stigma. So there is a lot that goes through the person's mind. So that is our starting point for us now to allay these psychological concerns and try to give these people hope. We give hope because, like you have heard it from Leah, who knows how many days God gave each person. So we try to give hope so that the person can live for the next day, or live for the other day, the other month, and the other year, till that time comes to go back to the Creator. You know, we all fear death. We all fear death, but matters of death should be left to God. After all, even those without cancer still go back to their Creator. And that is what disturbs most of the people when they get the diagnosis of cancer. They feel it is a death sentence, and we are saying no. Having cancer is not a death sentence. Just stay calm, find a solution. That is the way forward. Seek medical help, like Leah did. And you know, with cancer, if caught early, it can cure. You have heard it from Leah. 27 years after treatment, cancer can cure if caught early. You know, it has stages. It has stage 1, stage 2, stage 3, stage 4. The stage goes higher as it advances. So it's good when you are diagnosed with cancer, or even before. Let's be vigilant. Always check ourselves. Always be Be conscious of what is taking place in our bodies so that we always seek help early. And if it is diagnosed early, the better. You can still live your life that God gave you on earth. So, in my experience, a very difficult situations to deal with is denial. If someone is diagnosed with cancer and goes into denial, denial is so bad. Denial is bad to the extent that can lead to a person shortening life. You heard what Leah told you. The sister was saying, no, let the breast not go off. Even her herself, she was like, what? Yeah, it's normal. You know, our body, as we get this, the bad news, it is normal for the body to respond. But then later, you start gathering yourself and then come back and start reasoning and find what to do. So denial is very, very bad because it can lead now, because of the worries, the stigma, the anxiety, the fears, it can lead to depression. Depression is also another bad disease.
Trauma.
Depression itself kills. Depression can kill even before the cancer kills the patient. So, way forward is seeking medical help early enough. I think this is what helped Leah because she told the brother. The brother knew what to do. He went to see the doctor, then she was started on immediately, which was good. And now here she is. She has lived for other 27 years. If she had gone into denial and go to seek other things, then it would have been more dangerous. Another difficult situation that comes with the seniors, especially the seniors, and this one is especially in the men, is their sexual life. Sexual life, especially even when they have started the treatment, because there are some therapies that lower the libido. So they get worried, they feel nothing, they are no more. They are not fulfilling that obligation of being a man. So it makes them feel so down. And that one is also a difficult situation to deal with in our male seniors. And another difficult situation we deal with is when there is financial constraints. And you know, in the old ages, most of them are not productive. The money is not enough. So they usually, they are always struggling with their medical bills, struggling to come for treatment because there isn't enough money to support them. So that is it about the difficult situations. Then, what tips can I give to this about to some people who have been diagnosed with cancer? Acceptance is the first thing to do. Yes, you're going to fear, you get worried, you cry, you do what, but then that one is acceptable because it is a normal response of the body. But then later, gather yourself and accept and seek medical help. When you do that, the doctors will be able to do, then the nurses will do their work, the counselors will do their work, and then everything will move on smoothly. Another tip is about after you've sought treatment, when if the doctors to do whatever they want to do, because when you stick to your treatment plan, then we are able to control the disease. I've already told you, cancer starts in one place and then goes on spreading to the other parts of the body. So when you stick to your treatment, you adhere well to your treatment, cancer can be controlled. Remember, it is this treatment that controls the disease to spread. It's the same treatment that will kill the cancer cells, like in Leah's case. It is the same treatment that is going to cure you. So stick to that plan and avoid gambling. No, there are other issues that take away cancer patients, like herbal, witch doctors, the food supplements, and prayers. These are the things, the herbal, there's no herbal for cancer. No witch doctor will treat cancer. Food supplements, it's just food like you had it, food supplements. Because their land is not fertile. They come from China, India, and from wherever. So they are just making these capsules and tablets from fruits, nothing else. Fruits and vegetables. And yet for us here, we have them in abundance. Why go for an apple from a 10 at 20,000? Then an apple here is at 1,000. So food supplements is not meant to treat cancer. It is just food. I can only encourage you to pray while you're on treatment, because we know that God is above all. God has all the powers. We also treat as health workers, we also do our work. It is still God who heals. So pray while on treatment. Let people pray with you while on treatment. Then you'll find your miracle while on treatment. Like Leah said, she thanks God. Yeah, that is a miracle God has made in her life for giving her more years. Another tip I can give is eat healthy. By the way, this one about a balanced diet is for everyone, even us who are not having cancer. Everyone, even people who are not sick. Let us try and balance our diet as we eat. There are 3 groups of foods: food that gives us energy, food that builds our body, food that fights in disease. And gives our skin a nice look. So it's about balancing your meal. Ask yourself, what do I have in the house that is going to balance my meal? So make sure at the end of the day, you've eaten from each group of those foods. Then as a cancer patient, and to the caretakers, fluid intake. This chemotherapy is tough. You know, every medicine, every drug on earth has the toxins in them. So chemotherapy toxins are so high that they're so bad and they hit the patient. So fluid intake, let the patients drink a lot. Drinking a lot means taking minimum of 3 liters in 24 hours. 3 liters of water, juice, chai, porridge, kashera, whatever, any drink apart from alcohol. If the patient can, water is the best because it will always come out of the body easily. The reason behind this is for the body to be washed of these toxins. The medicine goes to the body, fight the disease to kill the cancer cells. But now the toxins are there in the body to disorganize the body and give you side effects. So when the patient is taking in a lot of fluid, as you know, when you take a lot, you'll be urinating a lot. So as this patient is urinating a lot, the toxins are going out of the body and the side effects will be less severe. Then there are also some cancers that may need hygiene. Okay, as seniors, old agers, let's ensure that there's always good hygiene around ourselves, our bodies, where we sleep, in our houses, around, so that our environment is good for us as old agers. I'm also putting myself there because I'm in the age group. Then another tip is exercising. Exercising is so good. It is recommended for everyone. Exercise. Take a walk. Do something in the house. Even when you're a senior, do something. Go to your farm and supervise. Whatever is there. Then there are these other exercises that are recommended by instructors. If you're able to do those, then you also continue with them. But the working in the house, outside the house, walking, jogging, all those can be helpful. So another tip is also about medical checkup. Let's always check ourselves. Let's check. Leah found a mass because she was checking her breast. Let us make it a habit. Always go for medical checkup, routine. Then the doctors will be able to find any other ailment, any other disease that is disturbing in the body, apart from cancer. Another tip, because I'd already said the most difficult situations, one of them is financial constraints. Save, let seniors be saving for their medical bills so that when that time comes, it is not so difficult for them to continue to go to hospitals and also be able to adhere well to treatment. So saving is a good thing. And yeah, I know families and caretakers and attendants also have challenges they go through. You know, cancer treatment. The journey is so long. Like you had Leah telling us, she, even after these major interventions of chemotherapy, surgery, and the radiotherapy, she still swallowed a pill for 5 years. So the journey is long, and being long, even the caretakers, the attendants, get challenges along the way. Financial constraints, that one cuts across. Sometimes if the senior is not well prepared with his savings, then even those taking care of him still find the same challenge. When they don't have enough money on them, it will always be a challenge for the patient to adhere well to treatment. Another challenge these caretakers and attendants go through and their families, it is the time to take care of their patients. You know, in this era, everyone is working. So everyone have their own programs. And sometimes these seniors default care because there was no one to bring them. They default care because there was no one to attend to them. They did not take their medicine well because there was no one to give the medicine. So these people taking care of the patient, the family, are challenged by the time how to balance their own programs and then taking care of the patient. Then another challenge that is there to the family members and caretakers is stigma. Sometimes they don't want people to know, to hear about cancer. Cancer, it sounds like, I don't know how I can put it, but some people don't like to know that their family members are having cancer. So it becomes a challenge. That stigma, like I said, stigma is so bad. So it becomes a challenge in a way that because they are trying to hide, this patient is likely to default treatment. This patient is likely not to comply with the instructions of taking their medicines. And then another challenge these family members have is fear for catching the disease. They don't know. When they hear cancer, it seems something so big and so bad to them. So they are fearing to catch the disease. And yet cancer is not infectious. So to families out there and the caretakers and whoever is listening now, tell them cancer is not infectious. Cancer doesn't catch like these other infections of HIV and the others. So when they come to us after diagnosis, we actually give them the information, we make them understand what cancer is and explain to them so that when they understand what they are dealing with, when they understand how to go about it, their roles, then they are likely to adhere well to treatment. So we make them understand so that they continue doing the right thing. Then about financial constraint, yeah, we sit and start talking about it, and we make sure we find ways of mobilizing, how the family can mobilize resources. So that one will always talk about it, especially to those patients that are financially constrained. Then also, for those that are having challenges with how to program their time, also talk about it so that either they can taking care of the patient, they can do it in shifts, or we always plan with them. And then, of course, the most important is now allaying their fears, their worries, the stigma, the talk about the death. So that is it that us as counselors, we do to help these people deal with the cancer diagnosis so that they can be able to walk the journey, feeling they have someone they are walking the journey with and that they are not alone. Yeah, that's all I can talk for now. I know this is not enough, but for now I can say that. And then if there are any questions, if there's anything I haven't cleared, then I leave you people to ask questions, then we can continue discussing. Thank you so much.
Thank you so much, Bira. You demystified a lot of things, situations to us. I'm happy that Leah is still on. So I would suggest that we do get our questions and comments and in the next 20-30 minutes so that those who need to depart early can take leave. Any questions specifically to Leah should come first. And I will ask Dr. Philippa to look at the chat and update us what's happening.
Calling after the live call.
Thank you very much, moderator, and thank you, Leah and Sister Bira, for all that you have said. Leah, that testimony was very touching, very real, and it was very sobering for us who are listening. And Sister Bira, it is very nice that you talked about what an individual goes through, what a family goes through. Sometimes it's good to hear these things and know that you're not the only one who's struggling with them, and that there's somewhere you can go to get help. There's one question, as the way maybe people can raise their hands and voice over if there are other questions that they haven't typed. So far we have one in the chat, and I think maybe both of the speakers could say something. Leah can give a personal experience, and Sister Bria can tell us from what she's seen. What the question is, what are the effects of radiotherapy that we need to be aware of? And maybe Sister Bria, you can add to that to tell us how you help people deal with some of the side effects of radiotherapy. Over to you, Sister and Leah.
Yes, thank you, moderator. Radiotherapy is also medicine that has its own toxins. So it has its side effects. So side effects of radiotherapy There are many, but it's not a must that every person will experience them. Because our bodies are different, we all respond differently to treatment. So the person will pick what, according to what, to how their body has responded. So radiotherapy can bring nausea, it can bring vomiting, the patient may lose appetite, they may experience some numbness, some dizziness. Radiotherapy darkens the skin of where it was pointed to, where the medicine is targeted, that skin darkens. So, like I said, there are many, but it's not a must that you get all of them. So, but now here, the most important is now how do we manage them? They are there. A good thing, they are side effects. Side effects do not kill, but the disease kills. Side effects are there for a short time during that period of treatment. So there's no worry, there's no fear, because we are trying to fight the disease, which is a killer. Because we are fighting the disease, so meaning the side effects, we have to bear them. The person has to bear them because we are trying to control the disease, we are fighting the disease. So this is what to do, fight the side effects. I already talked about it. Drinking a lot. Drink a lot so that those toxins that have gone to the body can be eliminated from the body through the susu. Also eating well. You know, when you're on treatment, the cancer treatment, it kills even the normal cells. So it is the food we eat that repairs the body. You know, every body cell, the cell is the smallest thing in the body. So repairing them, every second, many of them are dying off, and every second, many of them are being produced. And they are produced because there is what is repairing the body. So eat well, drink a lot. That's what I can say about the management. Unless if they are so tough and you need to come back to the doctor and explain, then there the doctor can do something. That is if they are more than what we expected. Thank you. Hello?
Bira, I think there are many other comments in the chat. In the meantime, Leah went through a very nasty experience. Do you think, are there any tips you can give to the care providers this time in the hospitals or in our settings of really how to handle the general population, the lay people who don't know that what the lump actually is cancer? Because she did tell us exactly what caused the deaths of the other family members, but the way one reacts, you could get a senior who comes with already heart issues and other health problems, and then you just throw the word cancer on top of everything. Do you have any advice you could give of really how to handle patients? In our setting today?
The doctor, moderator, is that to me or to Leah?
It's for you.
Yes. About other diseases, it's actually important to talk about them when you are with the doctor that is managing cancer. These doctors have specialized in cancer, but they have read everything about all the other diseases. So always talk to them. Tell them what other diseases are there with you. They will always know what to do. They will always encourage you to continue attending those other clinics. And it's also good for them to know because they will know which drug can match with the drugs they are going to prescribe. I know because even when the person is having cancer, doesn't mean the person will not have another disease. Or the cancer may come when the other disease is already there. So always talk about them. I encourage cancer patients to always talk about what other diseases they have so that the doctors can find a way of helping them better, and all the other diseases will be managed together with the cancer disease. Thank you.
All right, thank you, Sister Bira. There was a question which was actually talking exactly about that, where Twine was asking whether these other diseases like HIV and diabetes make it harder to treat cancer. And I think you've put it nicely to say that they can speak with a doctor who will be able to help them balance the drugs and make sure that the cancer and the other diseases are well taken care of in that patient. There are some other questions in the chat. If you can allow me to just read them and you can note them down and answer them at once. How can you help someone on treatment who is also diabetic? Which support do you give them as help? Probably this will be support which is outside the treatment, which you may speak about. And then why are some cancer patients treated with radiotherapy and chemotherapy concurrently, and to others one is preferred over the other? You can say something about that. And then thank you for organizing the program. It's of great benefit as it has given light about cancer. Thanks to Leah for sharing the experience. That's just a comment. Another question is, how do you manage and encourage the patient to maintain appetite and drinking, given that they are critical, as you have said? Secondly, how do you manage when the patient has other predisposing illnesses? Okay, this has come up again, like diabetes and high blood pressure. Then again, some thanks and a question, how should we deal with the news of a wrong diagnosis, especially in Uganda where you can never be sure? I imagine sooner or later, they find you healthy. Wouldn't the drugs taken after a wrong diagnosis affect one's health? Maybe you can answer those and we shall take another set of questions, sister.
Thank you, moderator. Oh, the concurrent treatment, I'm starting with that one of concurrent treatment, radiotherapy. These doctors, the oncologists, have specialized in cancer. When we are treating cancer, we are using 3 interventions, mainly the surgery, chemotherapy, radiotherapy, and there's the 4th one, the hormonal therapy. So these doctors, before they start the treatment, they will always do other tests, do other investigations, which help them to make the right decision. So the decision made for each patient is not the same. Some other patients will start with surgery, then chemo, then radiotherapy. Other patients will start with chemotherapy, surgery, then radiotherapy. Other patients will have only chemoradiation. This one depends on the assessment of the doctor who has done the assessment, and depending also on the stage of the disease, also where the disease is. There are many factors that they base on to make a decision. I would only encourage that go by what the oncologist has decided, because he is the doctor is the specialist. They know what they are doing, and always ask them. Let them tell you exactly why they are giving you that treatment, so that you get to understand. That is it about the chemo radiotherapy alone. Then about the news of a wrong diagnosis, I've not dealt with many of these people. I've not had such cases at Cancer Institute. I don't know if I got the question well. Because if I had well, the person was talking of a wrong diagnosis. That means being diagnosed with cancer, then takes the treatment, then later they say there's no cancer. I didn't get the question well. Maybe the person can talk and speak to us, and we get to understand what the person meant exactly. Are you there?
I think, Bira, maybe
Yes.
the person certainly is not a medical person, but we could ask Dr. Philippa to go through what happens if I present to a health unit, and that period before a decision to send you to Cancer Institute is made. Maybe that could help him realize that if a wrong diagnosis happens, it really happens rarely.
Right. I'll speak briefly about it. Yes, it's true that you may have a misdiagnosis sometimes, but for cancer, like Sister Bira said, most people will have treatment at the Uganda Cancer Institute. And before you get treatment at the UCI, you need to have a confirmed diagnosis. And confirmed here, we mean you have to have a histological, you've taken a piece of whatever it is that you think is cancerous and examined it under a microscope in the lab to confirm that actually it's cancer. Usually when you have a histological diagnosis is when you start chemotherapy when you have a confirmation on histology. So you will not usually have a person just looking at a patient and saying, this is cancer, start treatment. If you have that, I would say maybe, like Leah did, Leah's case, go and seek another opinion, probably even visit one of the screening clinics at the Uganda Cancer Institute and have a second opinion, because a cancer diagnosis is not usually done clinically by just looking at the patient. You will want to have histological confirmation before you start treatment, so that we do not expose patients to the chemotherapy. Like Sister Bria said, it's very toxic and you don't want to give it when the person does not need it. So that's what generally we'll do, have a confirmed diagnosis before we have someone start on the treatment. In the unfortunate event that that treatment was started just on clinical basis, someone looking and saying, from what you've told me, I think it's cancer, that's really unfortunate. And you'd have to stop the treatment immediately and go through the process of getting the correct diagnosis and having the person start the right treatment for whatever condition they may have. Right, that's what I can say about it. Back to you,
Yes.
Sister Bira, for the other questions.
Yes. Let me also highlight this about the same question. There are things that confuse people about when the patient is diagnosed with cancer. Before they start treatment, there are other investigations, we call it staging workup. Investigations that are made to be able to stage the patient, to know if the disease is still where it started from, or it has started spreading to the other parts of the body. And usually when it starts spreading, it goes to the lymph nodes, in the chest, it goes to the lungs, the abdomen, it goes to the liver, the kidneys, the pancreas, the bladder, and it also goes to the bones when it starts spreading. So when this patient is given staging workup to go and do, and they you know, especially if they know what to read, they usually read the conclusions. And if it hasn't spread, the conclusions will always say normal, normal, normal. So if the patient or even the caretakers are not wise enough to come back and discuss it with the doctor, they will take it upon themselves to say, the other X-ray said normal, meaning I don't have cancer. The other CT scan, everything was normal, meaning I don't have cancer. No, I am saying that is not the case. The disease is there, but it hasn't spread to the other parts of the body. That is what it means. Because I've had such patients who have defaulted like for 2-3 years. When they come back, when we try to talk to them, then they start telling us stories. You know, the person who did this told me everything was normal. So that is what usually confuses people. I want to clear that confusion. When the doctor asks you to go and do a test, even if you know how to read, come back and bring the results to the doctor to interpret for you and tell you the next step. Thank you.
Sister Bira, you are very, very right. And I just want to highlight that it happens now and then when a cancer diagnosis is missed. That may actually happen a lot more than the situation which was highlighted earlier. So as Sister Bira has said, the staging or the doctor works before they start treatment are very, very important. And interpretation of results is very, very important. Sometimes seniors are asked to carry out very expensive tests like MRI, and you feel that, no, this is unnecessary. Just having a swelling here, and this doctor said it's not cancerous. Please endeavor to do the tests and share results with the doctor responsible for ordering that test. Thank you. Dr. Philippa, you can take us on again.
Okay. Right. There's thanks, comments of thanks in the chat. I'll skip those. There's a question on, apart from breast and cervical cancer screening, what other tests can one do? And then what are the effects of taking very many prescribed drugs for a very long time? Sister Brea, you can just note those and we can answer together as we go along. There's a question, are patients and their relatives counseled before breaking the news to them? And thanks for organizing. My question is it true? Is it true positive thinking is helpful for cancer patients? Sister Brea, you can start on those and we can help as you go along.
Thank you. Before I start these ones, we just mentioned there's someone who talked about loss of appetite. How do we encourage the patient to raise the appetite? Yeah, because I'd already said one of the side effects is the loss of appetite. And yet we are saying it is food that is going to repair the body cells. So meaning the loss of appetite is coming because the person is on treatment. Meaning the patient is going to look at food as medicine. As long as the person is not vomiting the food, let the patient force in the food because they know, they have understood why they should eat the food. That is it about loss of appetite. Just eat food, throw it in the stomach. Then when it gets there, it will do still the work. Forcing food when there is loss of appetite is important. That is it about loss of appetite. Then being positive about cancer diagnosis. Yeah, it adds up a lot. Be positive about it. Acceptance. In any situation, once you accept the situation and look for a solution, then you'll be able to solve the problem. Yes, it is life-threatening, but then when you start become negative, it means that is denial, you're denying. So always be positive, seek medical help immediately. Then we move forward to solve the problem. At least we have had that. With the cancer treatment, you can control it. You can prolong your life. The objective here is to improve quality of life. We are improving the quality of life so that that tumor that was big can shrink and become small. If there's any bleeding, no more. If there is those symptoms, to reduce the symptom, the pain is reduced or gone so that the patient can live in a life that is pleasant. Just the beauty with being positive with the cancer diagnosis. Then the person was talking about effects. What are the effects of taking medicine for long? Of course, if we have said every drug, every medicine has side effects. And of course, the long effects are there, long-term effects. But the person having the disease has to weigh between the two, the effects and the disease to grow. These who have known that these effects, they come because of the treatment, but the treatment is also helping to control the disease to spread and spread. So that is it. Still, I'll still encourage you to always discuss it with your doctors. They will always advise you the right way about the medicine you're taking and the effects that are coming with them. Always talk to your doctors, they will always advise you rightly.
Thank you. Leah, did you
Yes,
still have
thank you.
another question? You can go on.
I think I'm done.
Right. I think there was a question though on what
Yeah,
other
this is
cancers to screen for. That's such a wide question, Susan, but I'd encourage that generally, just like Leah told us from her story, she checked, she used to have, she was in the habit of regularly checking herself. For women, the key cancers, the topmost cancers are breast and cervical cancer. So check your breasts regularly. If you have any symptoms related to your reproductive system, abnormal bleeding, you go quickly to a doctor to have it checked out. Just like a car, when you have your car and it starts making noise somewhere, many, especially for men, they will run to have it checked out. We need to do the same for our bodies. When the body is not, is doing something that it doesn't normally do, we should make it a habit to go and have it checked out, because cancer can happen in any part of the body, any part really. So you can do for breast, you check your breasts. For cervical cancer, for women, at least get a screening done. You go to a Uganda Cancer Institute, I believe, has a screening center for cervical cancer where you can go and have your screening done. For women, we should have at least one screening done in our lifetime, and then and more if possible. And then for men, if you have any changes in your urinary, in the way you urinate, please get checked also when you're above 40 years for men for prostate cancer, which are the common ones. There is also Kaposi sarcoma, which appears on the skin. It's the second most common cancer in Uganda overall. And they're just spots that start on the skin. So any funny spots you have on your skin, especially in people who are HIV positive, go and have them checked. So generally, Susan, the list of cancers is so long, and that the key point will be anything you see abnormal on your skin, have it checked out and be sure that it is not cancerous, and get treatment if needed for it. Right. There's a comment from Gertrude to add the loss of appetite, where she said, if there's loss of appetite in her experience as a patient, eating small portions of food more frequently helps.
Yeah.
Right.
Correct.
Yes, Sister
Also,
Bira.
yeah, to add on the checking in women about cervical cancer, it is recommended that every woman checks every 3 hours. Every 3 years. Have a checkup of cervical cancer every 3 years. I don't know why hours are coming to my head. It is a three-year checkup for cervical cancer. Then for those who are already have survived it, and for those who have HIV, it is recommended that they do it every year. Yeah, that is what I wanted to add on that. Thank you.
Okay, there's one more comment. Let me just get to the beginning of it. Thank you for the useful session. What are your interpretations on these fruits, graviola, soursop, chitaferi, to assist towards cancer treatment and enhance one's lifestyle? Plus having rind of lemon fruits grated to add to their diets. Then what about on perspectives of somebody's being more acidic than alkaline, and bodies prone to high toxicity and low toxicity? Okay, it's a long question, but asking about your experience with patients, cancer patients taking these fruits and the issues around acidity. Have you had an experience with that, Sister Bira?
Well, I can only
Sister
say,
Bira,
yes.
before you
Yes.
answer, Sister Bira,
yes,
there are also herbs which we hear are grown around Cancer Institute. and they are red, they have red leaves, and people are known to use them to boost their blood levels. And another one called Muzukiza. Can you add them to that list, please?
Sister
Back to
Vera, you
me?
can go on. Yes.
Yes. Okay, I can, me as on my own behalf, I can only encourage people to use whatever is edible. They can use, like the chitaferi. There are many other things you mentioned. As long as it is edible, they can use it because it has no harm. It goes to the body and does what it's supposed to do. I am only discouraging herbal medicine to combine it with the cancer treatment, because all the drugs that we take in our body, even in the food, it is processed in the what? Those in the liver. The toxins that are in there affect the liver. So if the person is on cancer treatment and is also taking herbal treatment, it is giving the liver double work and can end up damaging the liver. So if there are any cancer patients that are practicing it, maybe someone need to take up that research and do it. Because I don't have much to say about that. If it is helpful or not, I don't have what to comment about it. If Dr. Kadama has some knowledge about it, maybe can go ahead and tell us something about it.
We have several doctors online. I don't know if any of you has an experience you want to share.
As we wait for some others, I think there's an important point Sister Bria made earlier when she was talking with regards to food supplements, herbals for a patient with cancer. And I think the main take home that for me I'd want people to have, in addition to what Sister Bria has said, is that as you take the chitaferi, whatever fruits that kuzukiza, keep on your cancer treatment or prayers. Even if you just go to prayers, make sure you keep on your cancer treatment as prescribed by the doctor. The diversion to other things, and then you come back later when the cancer has spread to other places, it's harder to control, reduces your quality of life and reduces your chances of survival. So you can eat the fruit as long as the fruit is not poisonous, and continue with your cancer treatment. Instead of saying, I'm taking this fruit to make my body more alkaline or acidic. I'm not sure what the story is around those, but make sure you take your cancer treatment and make sure that the other thing, the fruit you're taking is not poisonous. Like Sister Bria has said, we don't know the effects of these herbs. Many of them are not well studied and may have other additional effects to the body, which we can't tell. And when we combine them with the cancer treatment, they give the body more work and might actually be damaging some body parts, because we really don't know. In medicine, we never study herbs, so we don't know what the different things in the Kadama are doing to the liver, to the kidney, and that there is a problem that you may be causing other damage to those other parts of the body, which you will not know. And the person who gives you those herbs will not tell you. We keep saying, in our practice, we keep saying that it is very uncommon for people to come back and say, I took this herb and it caused this side effect. Many times we never hear those stories. Those patients come to us, they are dying, they die. They never go back to the community to tell people that, this thing was not good, I took it and it wasn't good. The relatives keep quiet. So you only hear the good story of where he was started on cancer treatment, then went to Kadama. It seemed to work. Then he deteriorated very fast and went to hospital. They never come back to tell you that this worked for me many times. But generally, we would not encourage you to stop your cancer treatment. Or if you want, you can say that for me, I don't want this chemotherapy. I want to take my herbs. You've made a decision, and we all have a choice. You pick what works for you, but then don't come back and say that they didn't treat me well. I came. When you come late, your chances of survival are already very, very significantly reduced. So the doctors can only do what they can do once a cancer is advanced. But like we saw for Leah, once you come in early, your chances of survival and quality of life are very, very greatly improved. That's what I can add to that.
Dr. Philippa, I think you can, there's a comment by Patricia Chinuka. I think I'll just read it out. When people are elderly and yet have health challenges like prostate cancer and autoimmune, and have been advised to balance and also take milk and meat for their usefulness, yet others say most refrain from those products. This, I think, goes on to the complexities of diet, herbs, and whatever. I don't know if we need any special comment on this, really. It's just that let's take a balanced diet as Bira has advised. I think on this forum, we've had a session on diet. Once you take a balanced diet, whatever condition you have, you are likely to be on the right track. The balanced diet may include differences in portions on this or the other type of food, but generally you'll be on the right track and you are unlikely to cause more damage. If you deny the body a certain group of food, that may cause more damage than you taking that food, but in smaller quantities. Sister Bira, do you want to add on anything on that?
Yes. You know, when we talk of a balanced diet, meaning taking meals from all the three groups of food. When it comes to milk specifically, I know the person is not going to take milk in the morning at 11, at 2, then in the evening. Maybe a cup of milk in a day. That one is okay. That's taken a cup of milk. That is a protein that is going to help the body to build up. Then, and has also taken some fruits, then a portion with the genus, it is still okay. So people go beyond and talk about these things to be unhealthy, as if the person is going to take that particular food only and only. We are talking of a balanced diet, and you also encourage to eat in small portions. Everyone, even those who are not sick, eat 5 times a day. Eat small, not eating one big plate at once. Let us have the main plates, lunchtime and supper, whatever I call it, over lunchtime and dinner. Then morning around 11, then afternoon around 4, eat fruits so that you're able to balance your meals at the end of the day. Thank you.
Okay, I believe, moderator, we have addressed all the questions that we had. Back to you for the closing.
Thank you very much, Dr. Philippa. Thank you so much, Leah and Bira. I think this session has been touching, relevant, and very educative. It has wrapped almost all the sessions we've had. For those of you who have followed Purposeful Aging for long, we've seen the relevance of health in our mental status. We actually started that way. We've had exercises, we've had diet, we've had diseases like diabetes, hypertension, where we were, things like Lusania were discouraged, and that was touching on what should we eat and when and how, in what quantities. And as you have all seen or heard from Bira, she really went through all the tips we need for this very, very scaring but present disease called cancer, which actually attacks whether all of us, whether we are young or not. And she has mentioned particularly the expense one incurs when you are undergoing cancer treatment. And if you remember correctly, we had Mr. Mukasa taking us through preparation of our finances, of our properties for the later ages, for the seniors, how to prepare your life really for seniors. I think Bira and Leah, you've done us very, 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 let me say, good today. It has made our hearts lighter. We started off when we were looking at this monster, and you have demystified it. And there was a comment which wrapped up Leah's session. It was to do with, what Leah went through, and it was wrapped with okay, we shall pray for you. We shall, I think, it's not being said, but we shall be wiser when we live, and we shall be able to walk with each other through this almost inevitable situation of having cancer, either ourselves or with our families or with our workmates and all that. Wherever you are, you have some relevance in the lives of the people affected by the cancer. I have particularly been touched by what happens in the hospitals, or when a few of Ugandans come to seek for treatment. I think that area needs a lot. I think Bira was so clever. She didn't give us tips for how to set up the treatment facilities, but I think there is a big gap in that area. And those of you who are here, you can always contribute in your various ways through various channels, whether you are a patient or you are a policy maker. We have had it. Bira, once again, Leah, thank you so much. Dear participants, thank you so much for coming every end of month Saturday. Thank you so much. I think Philippa has not said it, but this is our last session this year, 2023. We are not going to be out of touch. Please keep in touch on our email, which has been posted. And you are invited to let us know particular areas, particular issues you would like us to touch on as we try to age purposefully through the next year, 2024. Thank you so much, everyone, and goodbye. Yes, the contact has been put on the screen. Thank you so much. Sometimes you are kind enough to put on your cameras for this last session so that we can see each other for a second. And our good Tina takes a photo, a screenshot of us. So at the count of 3, can you all put on your cameras? 1, 2, and 3.
One of us are still in bed.
Yeah. Yes, it is very common for us. We wake up at midday. But I think Tina was sharing something, so I don't know how you're gonna do that. There you are.
Yes.
Gallery. Nice to see you.
Thank
Good
you.
faithful ones. Always
Hi,
there.
everyone, once again. Nice meeting you people. Nice talking to you.
Merry Christmas to everyone.
And
Thank
Happy
you.
New Year.
Thank you all.
Merry Christmas. We'll meet again in
Yeah.
January at the last weekend, Jan.
Okay.
That's a
Merry
hard.
Christmas.
Mhm.
Thank you. Thank you, everyone. Thank you for inviting me. I'm so honored.
The educative
Thank you.